Good evening, today is June 3rd, and today I'll continue to be talking about the coronavirus. So the first piece of news that I'd like to talk about is that this time around, the economic fallout from the pandemic is threatening to derail the careers of an entire generation of working women. Unlike how the last time the United States went through an economic downturn, most of the job losses were shouldered by men. The pandemic has dramatically altered the way Americans work and care for our children, and women are carrying an unequal share of the burden. Women are more likely to have lost a job and are more likely to have children at home, even among married couples. Reopening the economy isn't helping, as childcare and babysitting options have evaporated. Women still have little choice but to give up jobs or work part-time to manage the responsibilities at home. And returning to the workforce, already a challenge for women who left to care for the children, will be especially hard in the recession as more out-of-work people compete for a reduced pool of jobs. So I think what is happening here is that the impact on working mothers could last a lifetime, and it could infect an entire generation of working women, reducing their earning potential and robbing them of future work opportunities. So I think what can be done to solve this problem is that men first, if they're not as busy, they can help out with looking after the children or something like that. And after all, we cannot let these women just lose their jobs, but we have to find ways to try to help them as well, maybe give them benefits or trying to have their employees keep their jobs. The second thing that I like to talk about is that the CDC has reported a 42% decrease in the visit to emergency rooms in the United States during April, compared to the same time period in 2019. The declines are greatest among children 14 and younger, women, and in geographic areas like the Northeast. The CDC also noted that there had been a recent rebound in visits, but the volume of visits remained significantly lower, and visits to the emergency room were down 26% in the last week of May compared with a year earlier. So, while there were high numbers of emergency visits because of the virus, including an increase in visits-related testing for infectious diseases and for pneumonia, they were outweighed by steep declines in visits that typically make up trips to the emergency room, for example, heart attacks, strokes, and such. This highlights the month-long decline in general hospital care as the virus took hold and overwhelmed some hospitals. Across the nation, hospitals stopped performing elective procedures even if they were not experiencing a surge in COVID patients. And while hospitals have slowly begun resuming care, starting elective surgeries again, many patients concerned about potential infection continue to avoid emergency room visits. And while ER treatment for complaints of minor alignments were far fewer this year, the more disconcerting drop in the number of people seeking emergency care for chest pain, including those undergoing a heart attack, is extremely worrisome. There are also declines in children requiring emergency help for conditions like asthma. So I think what families should do at this time is just you have to go to the emergency room if there is discomfort, because it could be life-threatening and you don't want to miss the perfect chance to treat it. The third thing that I like to talk about is that the Trump administration plans to block Chinese airlines from flying to the United States. And today it said that it would plan to block this after June 16, and after the Chinese government effectively prevented U.S. airlines from resuming service between the countries. So this seems to be a reaction to the China's aviation regulators that limited foreign carriers to one flight per week based on the flight schedules they had in place earlier that month. And this regulation is extremely does block many many American companies from flying, and as a result, Delta and United Airlines have tried to appeal to the Civil Aviation Authority of China, but did not receive a response. And while they still hope to resume flights to China this month, it is probably not likely. So tensions between the U.S. and China have escalated to heights not seen in the trade war, and while with the President Trump and his campaign team have taken a much tougher stand against the country. In mid as ground zero of the pandemic, China was the first country to see aviation grind to a halt this year. But even though there are many Chinese students, foreign students here in the United States, China is making it extremely difficult for anybody to get inside China. And while the cause of this is unknown, but it has been extremely difficult, and American companies are losing money right now. So the Trump administration is just making this move out of a response. That's it. Thank you for listening, and I hope you have a good day. Thank you.